So hi everyone, my name is Sophia. Thank you, Carol, for the introduction. I'm a pharmacist at Toronto Western Hospital in neurology and neurosurgery. So thank you for joining in this session. We'll be discussing medications for epilepsy. So we're going to discuss medications for epilepsy and important things to know. So this is just a note that the information that we discussed today is general, but you should speak to your own healthcare team about specific questions regarding your own case. So in today's talk, we'll discuss what things healthcare practitioners consider when choosing a medication for a patient, and we'll specifically focus on side effects. We'll discuss how to monitor medication levels, and we'll also touch on strategies to manage medications. So just to begin, we'll start looking at how seizures are classified. So this is the most recent classification from the International League Against Epilepsy. We have focal onset seizures, which were previously known as partial onset seizures, where electrical activity starts in one specific part of the brain. This can further be split into seizures with awareness and with impaired awareness. Sometimes the electrical activity can spread to affect both sides of the brain, and this is when we have bilateral tonic-clonic seizures. Next, we have general onset seizures, which affect both sides of the brain from the beginning of the seizure. And then we also have seizures from an unknown onset. So as you can see, there are many medications available in Canada, and they're all considered to be fairly equally effective. However, we don't specifically know which medication is going to work best for which patient. There are certain medications that are preferred depending on whether a patient has generalized onset or focal onset seizures. So how is it then that we decide which medication to choose for a patient? We generally consider a number of factors for each individual patient when starting a new medication, and this includes effectiveness, side effects of the medication, drug interactions with any other medications, individual factors for the patient, as well as cost and convenience. So we'll take a look at each of these categories. So for effectiveness, when we think about this, we definitely consider whether a patient has generalized onset or focal onset seizures and look at the medications listed for those specific seizure types, which we saw on the slide before. Ideally, patients would be controlled on one medication, and I'd say 70% of our patients are well controlled with one medication. However, for 30 to 35% of patients who have difficult to control seizures, they may need to be on more than one medication. For these patients, we'll often try to think of medications that might work in different ways so that we can try to target the seizures from different mechanisms. Next, we'll consider the side effect profile of medications, because this always needs to be balanced with how effective a medication is and how well it's working for the patient. If our patient we think might be more likely to develop a side effect of a medication, it might be a reason that we might choose not to select it for them at the beginning. We'll spend some time discussing specific side effects of medications. It's important to know that side effects don't necessarily happen to everyone, but we like patients to be aware so that if they do happen, you can speak to your healthcare team a little bit sooner to see if there are any strategies to help manage them. So the first type of side effects we'll discuss are dose-related side effects. These are the ones that can happen when you first start a medication or when you increase the dose of the medication. For example, most medications can cause people to feel like they have some double vision, feeling tired, drowsy, unsteady, or a little bit dizzy. More specifically, medications like levetiracetam, perampanel, and topiramate can cause mood changes like irritability or agitation. Lamotrigine can sometimes cause some trouble sleeping at nighttime for patients. Topiramate, with topiramate, people can sometimes have some word-finding difficulties or memory trouble. And valproic acid can sometimes cause a tremor that gets worse with movement. So sometimes these side effects can occur when a medication is first started, and they may just get better as the body gets used to the medication. But this is often why we start medications at a low dose and increase them slowly over a number of weeks to give the body time to adjust to the medicine. This can also happen sometimes if a dose of a medication is increased or if the dose is maybe just a little bit too high for you. So it's always helpful to talk to your doctor to see if they think it might be useful to maybe increase the dose more slowly or go back to the previous dose where you were feeling okay with the medication. There are also chronic side effects that can develop with long-term use of medications. There are some strategies that we can use to help prevent this, but if they do occur, it's important to talk to your doctor to see if a change in therapy is maybe needed. So for example, phenytoin can cause some cosmetic changes such as acne and hair growth, coarsening of facial features, and thickening of the gums and lips. So we always encourage good oral hygiene to patients when they're on this medication to help prevent some of the gum-related issues. Many medications can cause changes or decrease bone mineral density, and this is a side effect that we'll touch on in just a minute in more detail. Medications like oxcarbazepine and carbamazepine can cause decreased sodium or salt levels in the body. So sometimes we'll ask patients to have blood work checked to monitor those while they're on the medication. Topiramate is sometimes associated with kidney stones, so we'll encourage patients to try to drink more water while they're on this medication. Vigabatrin can sometimes affect vision, so we'll encourage people to have regular follow-up with their eye doctors to help monitor for this. And then topiramate can cause weight loss, whereas many other medications can cause weight gain. So we're going to talk about a few of the side effects in a little bit more detail. So some medications can affect mood, including depression, anxiety, and irritability. And some medications can also affect our thinking, including memory and concentration. Certain medications can actually affect mood positively, including valproic acid, carbamazepine, and lamotrigine. So these may be good options for people who already have some underlying mood problems. On the other hand, some medications can make mood a little bit worse. So things like levetiracetam, perampanel, topiramate can sometimes cause a little bit of decreased mood or some irritability and agitation. So we might choose to avoid this in people who might already have some underlying mood concerns. And then medications that sometimes can affect memory or are known to affect memory a little bit more than others include topiramate, carbamazepine, and phenytoin. Sometimes these side effects, if they occur, could improve with time, or if the dose is adjusted, or definitely when the medication is stopped if that's needed. It's helpful to be aware of these side effects and keep track of how you're feeling when you start a new medication. Sometimes it's useful to use a diary or a log to help keep track because sometimes it can be difficult, especially if there are new medications that have been introduced a few at a time, or you had a few changes in doses of your medicines. Some people find memory difficulties can be a little bit better managed if they try bringing more structure and organization into their lives. So things like keeping lists, setting alarms, making notes for yourself, a kind of scheduled routine to follow. Sometimes those things can help patients. But if the changes are consistent or bothersome, you can always follow up with your family doctor or neurologist a little bit sooner. The doctor can sometimes send a referral to some specialist services like a neuropsychologist who could do some memory testing and perhaps suggest some strategies, or to a therapist who could maybe offer some strategies like relaxation therapy or cognitive behavior therapy to help with things like low mood. If these are not enough, the doctor might consider lowering the dose of the medication to see if being on a lower dose or increasing it more slowly will help. And in cases where this is not enough either, sometimes the medication might need to be switched to something that's less likely to cause these side effects. So next, moving on to bone health. There are many risk factors for osteoporosis, and this includes things like ethnicity, family history of osteoporosis, a small frame, things like smoking and alcohol use, poor nutrition, and some medications. So for anti-seizure medications, there are definitely some that have a known risk to affect bone health, and this includes phenytoin, carbamazepine, phenobarbital, and primidone. There are other medications that might possibly affect bone health, and this includes oxcarbazepine, gabapentin, levetiracetam, lamotrigine, topiramate, and valproic acid. So what can we do to help this? If you are on a medication that's known to affect bone health, and especially if you've been taking it for a longer period of time, it's a good idea to talk to your doctor about whether a bone mineral density test would be a good idea to check. We can also try to get more vitamin D. There are some dietary sources like it's fortified in milk and cereal and some fatty fishes, but especially given our kind of climate here in Canada, sometimes we might not be getting as much as we need, and thinking about a supplement could be a good idea. For calcium, there's a lot of dietary sources like dairy, green veggies, and like fish. But if you feel like you're not able to get enough from your diet, perhaps talking to your doctor about whether a supplement would be a good idea, it would be helpful too. And then we can look at risk factors that we can help modify. So things like stopping smoking and alcohol, improving our diet, and exercise, particularly weight-bearing exercise, if your doctor thinks that that would be okay for you to do. The last side effect that we're going to talk about is a rash that can happen from anti-seizure medications. So this is not a common side effect, but it is something important to be aware of. It can happen regardless of dose. So there are basically certain medications that share a similar chemical structure that can put patients at higher risk of developing a drug-related rash. And this includes medications like phenytoin, phenobarbital, oxcarbazepine, carbamazepine, lamotrigine, and primidone. The reaction usually happens within the first 2 months of starting the medication. And because it can happen so long after starting the treatment, some people may not always associate it with a medication that they've been tolerating well for a few weeks. So that's why we think it's an important thing to make patients aware of. If this was to happen, you need to seek medical attention, because sometimes this reaction could progress to affect internal organs. So it's really important to speak to your doctor if something like this were to occur. So the next factor that we consider is drug interactions. So many anti-seizure medications can interfere or interact with other medications. Sometimes this could be with other anti-seizure medications, or it could be with medications for other conditions. When medications interact, one of them is usually causing the other one to either break down more slowly in the body so that there could be higher concentrations of it and you could have more side effects, or the one medication could cause the other one to break down more quickly so that you have lower levels of it in the body and you might not be getting the full benefit of the medication. So as a healthcare team, we're always looking at your list of medications along with the medication that we'd like to start for seizures to make sure that there aren't any interactions that would be harmful. So it's really important to let your healthcare team know of any changes to your medications. That includes starting something new, stopping something, or any dose changes. And we'd like to know about your prescription medications, over-the-counter medications, as well as natural products, which are often viewed as safe, but can definitely affect the body and are not always as safe as we assume. They can definitely interfere with medications, so it's important to list those to your team as well. Also, anytime you start or stop a medication, we ask you to self-monitor or watch yourself a little bit more closely for any changes to your seizure control. So this includes a change in how often you're having your seizures, how long the seizures are lasting, or any change in intensity. The next aspect that we consider is individual factors for a patient. So we talked about for some patients that might be more prone to developing certain side effects, we might avoid certain medications for that patient. Also for people who are planning to become pregnant in the future, there are certain medications that have more data supporting their safety during pregnancy. So those might be, we might be more likely to suggest those medications for planning of kind of any future pregnancies. And then for women who are pregnant, we need to consider things like seizure control could sometimes change because of the fluctuation in hormone levels, and that ideally we would want patients to be on as few medications as they could be during this time to prevent any unnecessary risk to the fetus. And then for other medical conditions, for people who have other underlying medical conditions, some anti-seizure medications can actually help with their other conditions as well. So for people who have trigeminal neuralgia or like facial nerve pain, gabapentin, pregabalin, and carbamazepine are helpful. For bipolar disorder, lamotrigine and valproic acid are helpful. For migraines, topiramate and valproic acid are helpful. And for nerve pain, gabapentin and pregabalin could be good options. So this way, one medication could help both underlying conditions, and it would reduce the number of pills that a patient needs to take. And then the last factor that we'll talk about is cost and convenience. So certain medications may be more expensive. So we do try to check if the patient has private insurance or coverage through a government drug program to make sure that they can access the medication that we're prescribing for them. And then for convenience, there are certain medications that need to be dosed more frequently throughout the day. And if a patient is consistently having difficulty taking it or remembering to take it, then we might consider an agent that's dosed less frequently to make sure that they're getting the full benefit of the medication. So those were the factors that we consider when choosing a medication for a patient. We'll switch gears a little bit and talk about monitoring of medications. So we can do some blood tests to measure the levels of medications in the body. If the levels are low, it might mean that you're at increased risk of having a seizure, whereas if the levels are too high, it might mean that you're at increased risk of having side effects. So the medications that we generally do levels for are phenytoin, carbamazepine, valproic acid, and phenobarbital. Levels are more commonly done in these medications because they have a narrow target range that we usually aim for, meaning that there's a fine line between having too little and too much of the medication in your system. They also tend to have more unpredictable levels in the body. And there's also been a lot of research done on these medications to kind of determine what that target range ideally would be for a patient. We can do blood tests to measure a lot of the newer medication levels as well, but this is often not needed because there's usually there are a little bit more predictable levels in the body, and there's a good correlation between the dose you're taking and the level that we expect there to be in the body. So when a doctor, your doctor might ask that you have blood tests done to check a medication level for a few different reasons. So if you're starting a new medication, we might want to see a level at that point to see how close you are to that target range that we're looking for. If you're changing the dose of a medication, or if we suspect that your medications might be interacting or interfering with each other, then a blood test might be helpful in that case as well. So these target levels that we have, that we compare your blood work to, most of those are done when the medication is at the lowest point in your body. So that means when you're just before you're going to take your next dose. So that's typically when we would like the blood work done. So for example, if you take your medication twice a day, it would be best to do your blood work first thing in the morning before you've taken your medication, and then you can take your medication with you and after you've had the blood work to take it at that time. It's also important to note that a level is just one piece of the puzzle. We look at that along with how well your seizures have been controlled or how you're tolerating the medication, and all of those things together will help us determine if a dose change is needed. And so finally, we'll touch on some strategies to manage epilepsy medications. Sometimes it can be overwhelming to be taking a lot of medications, whether they're for your seizures or for other conditions as well. So if you're having difficulty remembering to take your medication, the pharmacy can package them into a compliance or blister pack where your medications are laid out by day and time that you need to take them. So that can be helpful for some people. Other people prefer to buy their own kind of package, like a dose set from a pharmacy, and fill up a week's medications themselves. And that way you know for sure that you've taken your medication for that day. There are also pill reminder apps to help alert you when your medications are due. So some patients find that helpful as well. We also suggest keeping a log of the medications that you've trialed. And to keep a record of ones that have been stopped, whether they were stopped because they didn't work for you, or if they had to be stopped because of side effects, and what kind of side effects you experienced at that time. This kind of information is really helpful for any new doctors you might be meeting in the future to have a good understanding of your history so that they can make the best plan for you moving forward. So in summary, I just wanted to say that there are many factors that we consider when starting a new medication for a patient. Side effects don't necessarily happen to everybody, but it's important to be aware of them so that you can think about ways to manage or to strategies to help manage them, or talk to your doctor about them a little bit sooner. Many anti-seizure medications can interact with one another, so it's important to let your team know of any changes to your medications. Blood tests can be done for some medications, and if you are asked to do one, it's best to try to do it as close as you can to the next dose that you're supposed to take. And then it's important to keep a seizure diary or log to help keep track of changes to your medications and how you're feeling with those changes in terms of seizure control as well as side effects. And that brings me to the end of the presentation. Thank you so much for listening, and if you have any questions, then I'm happy to take them.
Thank you so much, Sophia. That was very informative. I learned a few things. That's very helpful because sometimes patients also have a lot of questions about medications that I'm not able to answer, but at least I have some more insight, and I can probably offer better advice. While persons are typing questions, if you can fill out the evaluation form, that'll be great. It's in the chat box. I just sent it, so everyone should be seeing it. And at this time, feel free to type in any questions that you would have, that you would like to know more about, maybe about the medication or other questions you might have, and I will try my best to address those questions. Okay, so I am taking carbo, and Sophie, please correct me if I'm pronouncing the medication incorrectly. I'm taking carbamazepine after fully withdrawing from from carbamazepine in July 2020. My memory drastically improved, both long-term and short-term. Is it correct that they are correlated?
So it's, I'd say it's hard to tell. It's not one of the ones that's, well, actually, carbamazepine is one of the ones that can affect memory. So it's possible that that it could have affected memory. Sometimes when our anti-seizure medications, they're working to kind of reduce the electrical activity in the brain to help stop the seizures. So they can have impact sometimes on other functions of our brain. So it is possible that there could be a correlation. Unfortunately, there has to be a balance between what works best for seizures and what side effects we can tolerate. So I talked to your doctor about perhaps if they think anything else could have contributed, because it's not always just the medications. But if they do think it could be the medications, perhaps a lower dose, or maybe a medication that works in a similar way, but just trying a different one could be an option as well. But it would be best to talk to your doctor about if they think anything else could have contributed.
Thank you, Sophia. I see someone else is typing here. Okay, that person said, thank you. Any other questions? Sophia, while someone else is typing, is there any for vitamin D and calcium supplements? Are there any particular brands that you would recommend, or should that be something that you would ask your doctor about? Like, because I know there's so many vitamin D supplements and calcium out there. Would you recommend any one in particular? Any
I
type?
wouldn't I wouldn't say any one in particular. I think like there's a lot of different ones when you go to the pharmacy, and the community pharmacists could help you choose one. Like the vitamin D comes in drops and tablets. Most of them are fairly similar. The calcium comes in different salts, but it's just important to know the elemental level that you're getting from each tablet. So I think that they might be able to help you at the pharmacy choose one that's good for you, and also to just check with your doctor to make sure that they're okay with you taking it.
Okay. After a nearly 10-minute seizure, my son's valproic acid was 1006 to 1. Would that cause a seizure?
So it's also hard to tell. So depending on when that level was taken, because again, the target for valproic acid usually will go up to like 700, but that's when it's at the lowest point in your body. So right before you were going to take your next dose. Sometimes if we draw like a level at a different time, it could be higher, but we don't necessarily know what to make of it. But sometimes, if your levels were very high for some reason, it could put people at risk of having a seizure.
How often should patients check their blood level? Is that something the doctor recommends, or do this pharmacist recommend, okay, you should, check your blood level at this time?
So it does vary for patients. So perhaps like when you're first starting a medication, or if there have been some adjustments in your medication, or you've just come out of the hospital and some changes were made, then sometimes the level would be done kind of around that point after a few weeks of starting something new. And then if things are deemed to kind of be stable, then there wouldn't necessarily repeat blood work routinely. It's more if things are not stable, for example, they're continuing to have seizures, or things were stable for a while and then you've had a seizure. In those cases, it might be helpful to see if there's been a change. But if things are stable, then we don't necessarily do routine blood work. So it's very patient dependent.
Okay. Um, I was just recently started on my third medication. One of them is Dilantin. What are the pregnancy risks?
For Dilantin
Dilantin.
specific.
Yeah.
So Dilantin is one of the ones that we would prefer if we could not, for people who want to become pregnant, not to be on. Um, there can be risks like cardiac risks associated with that. So it is one of the ones that we would prefer not to. Again, there are always some cases where people have been through a lot of medications and things are not well controlled. So that's always a discussion with your neurologist to talk about the specific risks versus benefits for each individual patient. So it would be one of the ones not preferred, but I can't say that it would necessarily never be used. There are other ones that if people are of childbearing age that we would prefer people to be on if they're thinking about pregnancy.
So just to clarify, the cardiac risk, is that to the mother or the baby if they use Dilantin during pregnancy?
To the baby.
To the baby, okay. And how long, if a woman is considering trying to get pregnant, how long would she stay off of medications that might cause a risk to the baby? If she's planning, is there a period of time that she has to stay away from those medications?
I would say as early as possible because if you were to switch to something else, you also need time to make sure that you're stable on those medications and that the seizures are well controlled because seizures, of course, can also be could also put yourself and your baby at risk during pregnancy. So as soon as possible would be good to have that discussion with your neurologist about a plan for medications if you were to get
Pregnant. Okay, I see someone is typing here. Another common question that I have a lot about medications that cause changes in mood. And sometimes patients are using more than one medication and they really can't tell which one of the medications are causing a change in their mood. But or they might say, this medication is working for my seizures. Since I'm using this medication, I don't get a lot of seizures, but the side effect is that I'm very moody. I'm very irritable all the time, and so on. What advice would you give to a patient who's kind of stuck in that way where the medication is working for their seizures, but then it's really severely affecting their mood?
Yeah, yeah. That is really hard. Like it's hard to balance side effects and how well seizures are controlled.
Mm-hmm.
So I would, like I mentioned, sometimes the doctor can send forward referrals to things like therapists to see if non-medication ways could maybe help manage some of those, like things like relaxation therapy, cognitive behavior therapy to see if any of those would be helpful. If they're not, there's there's always the option to try something else, but then seizures may not be as well controlled. So it's a
Mm-hmm.
discussion to have whether you want to try that, and there could be another option for a medication that works similarly, but might not have that as a side effect as much.
Mm-hmm.
Or sometimes starting a medication for mood can help patients as well, and that could be a possibility to see if that would help balance that the side effects and how well seizures are controlled.
Okay, thank you. Are there any other questions anyone has for Sophia? Let me see. Did I miss anyone? I don't think so. If there, oh, someone seems to be. So I think we are going to be off the early stop today. I don't see anyone else typing questions. Before we, uh, let me just see. Let me check to see if there's anything. Because there's No, I don't think I'm seeing anything else here. Oh, there's one question in the form. So I'll read it out. Someone, just bear with me while the Excel sheet is opening. Okay, so the question is, how do medications affect fertility, postnatal care like breastfeeding, and and is it possible to avoid epilepsy medication altogether to avoid extra risk of child defects?
So it's a really big topic, and I don't know that we'd be able to cover that today. It's kind of a whole different talk. But
Okay.
the general consensus is definitely that seizures are very harmful to both mother and fetus. And so definitely we encourage continuing anti-seizure medications, but working with your neurologist to come up with that best plan ahead of time if possible. For breastfeeding, there are certain medications or medications can get into breast milk, but there are definitely certain ones that are safer than others. So I would definitely talk to your doctor about whether you're on those medications that would be optimal for that, and if not, if things could be arranged or hopefully optimized before pregnancy.
Okay, I think another part of the question is if the medications, if epilepsy medications cause infertility.
Some of them can. I'd have to like if there's a specific one, I'd have to say that I'm not sure kind of off the top of my head, but I'm happy to look into it and let you know if there's a specific one that you're looking at.
Okay. Okay, so that is it for today. Thank you all for attending. Sophie, it was very, the questions and answer period is always what I most look forward to myself because it gives patients the opportunity to ask questions about things that they might have had, be confused about or wanted to know more information about. So this was definitely very helpful. So thank you for presenting today. Thank you all for attending, and don't forget to complete the evaluation form before you leave the meeting. Thank you all.
Okay, thank you. Thank you for inviting me, and thank you everyone for listening.
Thank you. Bye.